Good morning, I'm Sunetra Choudhury, political editor of the Hindustan Times, bringing you all that you need to know about COVID-19 on Friday, the 28th of August. First up, a look at the numbers. We've seen record highs in the last 24 hours, a total 76,870 new cases. More than 1,000 people have died in the last 24 hours. Which brings us to our top story. Will we cross America, who had the highest number of cases by any country in a single day, 78.5 thousand cases, but that was in July. We've seen the cases rise steadily, which has been a major cause of concern. Cabinet Secretary holding a meeting with health secretaries from across the country in the worst affected areas. We've seen in the last 2 days the numbers rising further. They crossed 75 and now we've seen it cross 76,000. What's also of concern is the resurgence of cases in some areas like Delhi, which had gone down to just 900 odd cases in the beginning of the month, but now has seen steady increase in the number of cases. In fact, in the last 24 hours, we've seen 1,840 new cases. The positivity rate in Delhi has also risen from the 5% that we were seeing in July to 8% so far. But of course, authorities say that things are under control in the capital. The next story that we have is how 10 people of the Great Andaman tribe, which is a rare tribe, it only has about 50 people, and 10 of them have been impacted by the coronavirus. A team of health officials was dispatched by ferry to the Strait Island, which is a tiny island where they live. Many of the islands where these rare tribes live in the Andamans are not accessible for the general public. But when they tested positive, they were brought to the hospital. 6 of them are said to have recovered. 4 are still in hospital. That's one area where authorities are paying a great deal of attention to. The ICMR is going to start a second Sero Survey. The same 69 districts which were targeted by the first Sero Survey in May are going to be looked at again, and 24,000 samples are going to be taken. Now, when the survey was first done in May, it showed a 0.73% prevalence. Now, what they want to see right now is at that time, there was a lockdown. Now there's been unlockdowns. They want to see how much that prevalence has increased since then. And the results of this is expected to be out in September. Well, we know, and there's a lot of controversy right now about the exams that are going to be held by NEET and the joint entrance exams. It is dividing people, many states, many parents saying that it's unfair of the government to hold this. The government, of course, says that they don't want a 0 year. But we now have a figure across the world and in India of just how many people don't have internet access. Remember, online learning is the only way that schools have been able to continue teaching during the pandemic. But it says that 463 million school students have no access to online classes. That's a third of the world's population. And in India, that's 1 point. In fact, we know that 24% of homes are the only ones that have online access. The number of children that have access is meant to be much smaller than that. 1.5 million schools in India have been closed since the pandemic, since March, and many more millions of children going without it. Perhaps in this context, the Delhi University has said, and in order to reduce the chances of infection, they're allowing all the children who come to them for the exams, the university exams, they will allow them to carry all their devices, whether it's phones or their laptops, so that they can access the question papers. They can also bring in their answer sheets and use that, so they don't have to physically give the question papers. They can see them. They'll be WhatsApp to them on their phones or email to them, and then they can answer their questions. So novel ways being adopted during the pandemic. And finally, news about vaccine, and it seems that rich countries have backed the maximum number of vaccines. In fact, they've already pre-ordered 4.4 billion doses. US, UK are the ones who are leading these pre-orders, which means that lower and middle income group countries may have to be longer on the waiting list. The saving grace for countries like India is that some of the vaccines are being manufactured here, especially the AstraZeneca one by the Serum Institute of India. Well, those are the news updates for now. Keep tracking them on hindustantimes.com.